Number one, I wouldn't acknowledge I had a mental health problem. I thought I had a Bruce Simpson personal inadequacy problem, that it was my own weakness. Don't complain about it, don't whine, nobody wants to hear it, suck it up, be a man, all those stereotypes that are totally useless and problematic. I went to Lafayette High School, started in UK in 1968. I was very successful in protesting the war to the point that I didn't go to class, flunked out, got drafted, came back after a couple of years and started back in 72 and went straight on through and got my bachelor's degree and then went on and got a master's degree. Worked for several years and then went to law school in 1980, graduated in 1983. Always felt an identity with the underdog, if you will, or the person that hasn't been quite highly regarded or respected. I had some health issues in 2022 and was in hospital for a couple of weeks in ICU from a fall that I had that resulted in a brain bleed. And my treating physician was talking to me after I was released and suggested, like, Bruce, you've been through a lot. What about seeing somebody? And I said, seeing somebody? Like, what, a psychiatrist or something? Well, or some mental health professional. I was insulted. No way. Me? I don't need no psychiatrist. I don't have no mental health problem. I'm wearing this cloak of a lawyer and a role, and I like being an advocate, and I like fighting for my clients. And I didn't want to give any sense of weakness, and plus there's such a stigma attached to mental health, which is the biggest deterrent of people getting help, as I've come to learn. The truth of the matter is, as I said, starting from being a young person, really aggravated during my teenage years, adolescent, and then all the way through feelings of poor self-worth. And once I became a lawyer and I had this quote-unquote esteemed career, at least in the label form, I still felt inadequate, and I felt like I was a fraud, even though people told me I was doing well. The truth of the matter is, for 30 years, I was prepared to kill myself if I ever lost the reputation that people told me that I had as a good lawyer. And because I would see lawyers that got in trouble and read about them in the paper and think, my gosh, man, I couldn't handle that. I'd be dead. And I was actually mentally prepared to kill myself for 30 years. It wasn't that day in January of 2023 when I picked up a mail and read got an opinion from the Kentucky Court of Appeals in a case, a very high-profile case that had a lot of publicity because I won it. And I read the opinion, and it noted that I hadn't filed a brief in the case. I'm like, what? Of course I did. No, I won this case. Why wouldn't I file a brief? And I checked, and I didn't. And I immediately kicked into suicide. That was the only way I could cope. I was entirely comfortable with death, self-inflicted death for 30 years. That I think it was, it's part of who I was. I just thought, well, I'm just weak, and that's my way of handling my weakness. I'm just a worthless, weak human being, honestly. I never said this until I was put in the hospital with handcuffs. I was there 3 days. I with all the other patients, most of whom were much more ill than I was, long-term chronic mental health issues. But we all mingled together. They didn't know me, the staff. I was just another resident, another patient. But I paid attention the whole time I was there, the whole 3 days, just to see how they treated people. And I was stunned at how well they treated people. I guess I had low expectations. From the stigma associated with mental hospitals and the movies that you see and all of it collectively, the interaction between the staff and the patients and the level of compassion and genuine interest. It wasn't fake either. It wasn't, I know fake. you have to be a pretty unusual person to have to deal with highly ill people with mental issues, significant impairments, and still demonstrate genuine compassion and interest. That's rare. From an institutional treatment standpoint, it's exceptionally rare. So they had to handcuff me to get there, but because they did, they saved my life, and I will forever be indebted to Eastern State Hospital and the people that work there. So I'm blessed to be here, and I want other people to know you can be helped. Mental health treatment works. Medication works. I will also say faith in God and belief in God and following His will is critical to your recovery. But you have to have all of it. And it changed my whole way of thinking. And I'm like, I have got to let people know who are suffering in silence, because many do. I know, I've talked to them. With depression and other forms of mental illness, afraid to get treatment, afraid of the label, afraid of being made fun of, afraid of people finding out about it. And it just gets worse. It festers and festers, and then you have a breaking point like I did, where it all caves in on you. And, if you've got a stomach ache, you're going to go to the doctor if you can't get over the counter medication. If your heart's palpitating, fast, you're going to go to the doctor. If you're having problems breathing or you get COVID, you're going to the doctor. But if you got depression, you're just as likely not to see anybody or even acknowledge you got a mental health problem. I mean, that is just a cultural correction we need to make. We need to talk about mental health treatment, talk about mental illness. Mental illness is just as legitimate as cancer, heart disease, and broken bones. If things get overwrought, don't be afraid of going to Eastern State. Embrace it. Be grateful. Honestly, I'm grateful. It's an excellent place with very caring staff who are looking after your best interest. And that's rare. That's truly rare. Especially for a class of folk that are so disrespected and disparaged by most of the people in our community. But if you find yourself like I did, hopefully not in handcuffs, hopefully not involuntarily committed, but if you find the need to have to be there, even if you are involuntarily committed, consider yourself fortunate. Very fortunate.